We're seeing a surge in burnout and turnover among anesthesiologists. Here's what's driving it. Almost 9 out of 10 anesthesiologists are required to take call, but a lot of them don't actually get paid for it. So it's no surprise that over 80% of those physicians are reporting call responsibility as a leading cause of burnout. And more than 40% of anesthesiologists are planning to leave their current role within just 2 years. More than half of anesthesiologists are already over the age of 55. So retirements are going to hit hard, leaving operating rooms short-staffed. Becker's reports we could be facing a shortfall of more than 12,000 anesthesiologists by the year 2033.
All right, a couple thoughts on this. One, there is going to be a shortage of anesthesiologists by 2035. Why? Because of the amount of surgeries are increasing, the patient population is increasing, but the total amount of anesthesiologists being trained is not changing at all. Two, because of the fact that anesthesiologists were considered commodities for a long time, meaning they had to work certain shifts, came in and worked your 8, 10, 12, 24-hour shift, they weren't really treated with the same respect as surgeons. However, their schedules, their time, their commitment, their effort in the operating rooms were tied to the surgeons. So if the surgeons ran later, if the surgeries ran later, if the surgeries more complicated than they were supposed to, or if there are emergencies added on, you ended up staying a lot longer. Finally, because of the fact that after the pandemic, a lot of physicians and people in general have realized that they don't want to spend endless amount of time in the endless amount of hours in the hospital, but they would rather have a work-life balance. There's more of a shift toward a work-life balance. Because of Obamacare, a lot of the healthy patients and a lot of the easy surgeries have moved to surgery centers, and a lot of the sicker patients are in the hospitals. And because of that, it's more demanding hours, but it's also more demanding care, but you're being paid the same, and anesthesia salaries have not really kept up with everybody else. Finally, a lot of the surgeons are under what they call as an incentive model. So the amount of surgeries they do, the more they get paid. However, anesthesiologists are more linear. So the amount of hours you work is what you get paid. And unfortunately, if you work 60, 80, 100 hours a week as an anesthesiologist, it tends to not hit the same way it does for a surgeon, who gets a lot more, I guess, incentive in that situation. So I think that shortage is absolutely real. I think it's going to get worse. I think a lot of hospitals are recognizing that at the bottom of the funnel, everything funnels through anesthesia at the end of the day, because 70% of the revenues are driven in the hospital by anesthesia and surgery and the operating room. So if you don't have enough anesthesiologists, if you don't have enough anesthesia providers, including CRNAs and AAs, a lot of the hospitals are going to have a choke point on their revenue, on their ability to operate, on their ability to work as a hospital in the community, because if you can't drive revenue, you can't keep the lights on. So I think that this is a much bigger issue than it's being led on to be. And very thankful for Salary Doctor bringing it up and making it a big deal. I love you guys. What do you think? I think anesthesiologists are the most important jobs in the hospital. I'll see you on the next one.